Colorado's current surge of COVID cases, almost 900 confirmed cases in hospitalized patients, that's approaching levels seen in the very first wave of the pandemic here. About 10 Coloradans are dying of COVID each day. Today, the state released information that people have been asking for months. A breakdown of how many of those serious cases are happening in vaccinated people. It confirms what doctors have said, that this surge is mostly impacting the unvaccinated. Anusha Roy looks at what we're learning.
This is the online dashboard people have been waiting for. It shows vaccinated breakthrough cases versus unvaccinated. The same breakdown for hospitalizations and deaths. The state gave concrete numbers that a fully vaccinated person is 3.7 times less likely to be hospitalized and 5.8 times less likely to die from COVID. It's essentially telling us the same thing health experts were already saying.
Even though it's not zero, your vaccine is still very protective.
So what is the point of this? The state health department said it's transparency.
Clear information about the different level of risk of becoming a COVID-19 case, of being hospitalized or dying of COVID-19 if you are unvaccinated versus vaccinated right now.
And yet the state said that there is a lag in the data coming into their systems. 1 week for vaccine breakthrough data, 2 weeks for hospitalized breakthrough cases, and 3 weeks for death data. Even though hospitals were told to start reporting vaccination cases on a daily basis through a governor's order.
Hospitals are reporting to us through that system is aggregate data. It's not the highest quality patient level data.
So the state pulls in multiple sources of data to get a better sense of what's going on, which takes time.
So we don't expect our vaccine breakthrough rates to change overnight. Even with the emergence of the Delta variant, it really took a while for Delta to emerge and become the dominant strain and to see that impact on our vaccine effectiveness data here in Colorado.
The trends are probably more important than any given day.
And if nothing else, it allows people to do some fact checking themselves.
Transparency is something that is needed for people to just feel like they're getting the whole story.
So Dr. Barron from UC Health said that the daily reporting, that goes beyond just vaccination status and cases, but it's also a way for them to keep tabs on capacity, beds, and equipment, because Kyle, we're still in this phase, right, where it's just day-to-day operations during the pandemic.
And Anusha, when they're looking at these breakthrough infections in people who have been vaccinated, they're looking at what? A person's health, their behavior, which vaccine they got.
Yeah, absolutely. So there was a couple of interesting data sets today, right? We have older people who have gotten breakthrough cases, and that could be waning immunity, underlying health conditions, or maybe they just didn't have a robust reaction to the vaccine. But then we're also seeing breakthrough cases in that 20 to 49-year-old category. And there's a whole bunch of things that are being looked at right now, Kyle. Anything from, do they have jobs where they're seeing a lot of people? Are they just out and about more? They're starting to look at different efficacy for vaccines, but overall the state was saying that people should expect with breakthrough cases, as more people get vaccines, that number's also going to inch up as well.
All right, Anusha, we will continue to watch it. Thank you for that breakdown.